Through this Friday, ABC 10 is examining UP hospitals and how they're trying to keep local patients from leaving the area for health care. Baraga County Memorial Hospital in Lawrence is a 15-bed critical access hospital. It has about 125 employees and 8 physicians. Our senior news reporter Mike Hoey tonight looks at what they're doing in part 8 of our series we call Healthcare at Home.
8 months ago, Baraga County Memorial Hospital moved from its longtime home on Main Street in downtown Lawrence to US 41. Staff say the new hospital has been great so far, especially when it comes to outpatient areas. It includes a much larger emergency room.
Instead of having 2 beds in our emergency room, we now have 7. It allows people to have more privacy when they're coming in to get the care. We no longer have people in the hall waiting to be seen. We actually can put them in a room, so that's been really nice.
The new home cost nearly $30 million. The hospital spared no expense to bring in upgraded technology, including in the operating room and in radiology services.
MRI, CT, nuclear medicine, and those things I think a lot of people don't understand that they're here, and we're also hooked up by digitally through what's called a PAC system, real time with radiologists in Marquette General.
Baraga County Memorial also offers another cancer-related area that has seen a boost from last year's move.
We do offer chemotherapy services here so that people who are going through their cancer treatment or other disorders can actually get their care here in the community and they don't have to travel for it.
And there are some new procedures that they couldn't have done at the old hospital.
Infusions for oncology patients where before they would have to travel to have that done. Typically those patients are nauseous, they don't feel good, and they have to be put in a car after they're done. Now they can actually just come here.
Potential patients had been leaving the area for pediatric services for quite some time, so the hospital recruited an award-winning pediatrician from Indiana who started working there in December.
So we can provide, the pediatrician services of a specialist. We have the ability to have, kids to come in for their well-child visits and things like that, and actually see a pediatrician who is the expert in childhood development.
CEO Tim Zwicky says the hospital is very different now from when he arrived 13 months ago. He says that at that time, the hospital hadn't recruited any new physicians in 5 or 6 years.
And we also have a new family practice, a female family practice doctor scheduled to come the 1st of March. And that's going to be really nice for the female residents of the county.
We'll examine Bell Hospital in Ishpeming tomorrow night. Mike Hoey, ABC 10 and CW5 News Now.